Good morning and welcome you here again on this targeted communities presentation. You had the gist of what our activities will be in the panel. Now I'm going to discuss a little more broad way. Okay, some of the slides may be repetitious that what I showed you there. Okay, this project is called Vocational Rehabilitation Technical Assistance Center for Targeted Communities, RRTC-EBP. So there's a big mouthful, so we decided to have a different acronym called Project E3, because major focus is educate, empower and employ. The focus is how can improve employment opportunities for people with disabilities throughout the country. So that's why we said Project E3. Wait a minute, why is not moving? What's the, oh, this one?
You just got to put it in.
Oh.
And then you can either hit the arrow buttons.
Okay, yeah, that'll be fine.
Or, oh.
Yeah, that's fine.
Okay. It's in presentation mode.
Oh, okay, good. This is fine. Okay. So our partners are, Southern University, as you mentioned, and then our partners are University of Wisconsin-Madison. We have in Southern University, I'm the project director, and Dr. Alo Dutta is the principal investigator. And from the University of Wisconsin, Dr. Tim Tanzi and Dr. Fong Chen. And from the Stout is Kate Anderson and John Louis. And from George Washington University, Dr. Maureen McGuire Coolidge, and University of Illinois, David Strausser, University of Kentucky, Dr. Malachi Bishop, and CSAVR John Connolly, who is present here. And then besides that, we have a group of consultants throughout the country who will be providing TA services. And Mr. Felipe Lully from RSA is our project officer and who is guiding us in this project. Okay. This project, as I mentioned, a combination of other partners, but we developed this project with support from the Louisiana Rehabilitation Services and involves one historically black university, that's Southern University, and 5 institutions of higher education and Council of State Administrators for Vocational Rehabilitation. The major purpose of this project is how we can provide state VR agencies and their partners with the skills and competencies needed to effectively and efficiently address barriers to employment, competitive integrated employment, and community integration encountered by persons with disability for economically disadvantaged targeted communities and high leverage group of national applicability. Here is a two words that you need to pay attention: targeted communities and high leverage groups of national applicability. What does it mean? So we're going to elaborate on that, and I mentioned that this project is a uncharted territory, a lot of unknown. So we'll be on the ground in the targeted communities, find out from them what their needs are in collaboration with state VR agencies, and we'll develop our work activity based on that. So targeted community means, here are the definitions of targeted communities. That means the economically disadvantaged community that qualifies as an empowerment zone. And we discussed about the empowerment zone that is in 9 census regions of the United States and its territories. But the main focus is that the median household income is below 200% of the federal poverty level. That is one criteria. The another one is unemployment rate is or at above the national average. And also it says as a group, these individuals with disabilities have historically sought and been determined eligible or receive VR services from state VR agencies at less than 65% of the average rate of state VR agency, and also who have achieved competitive integrated employment average rate outcome also less than 65% of the average rate. So that's where our work activity will be. Now, here it is the map of the census region and divisions of the United States, different divisions of the United States. But there are a lot of other definitions of empowerment zone or renewal community. I would not go into details, but I showed you there is a discussion about this issue in the website, and you can look into it. For example, I just give you one map here in New Orleans. New Orleans is an area of empowerment zone or a community there that we will be able to use it. Now, examples of high leverage groups of national applicability, what does it mean? This says the people who lives in rural and remote area communities. For example, in Louisiana, we have very rural communities in bayous. People still travel on boat from going one place to another. If they do not speak English, they speak Creole, a combination of French and English. And think about other rural areas in Texas, in southern Texas specifically, Arkansas, or say Alaska, Montana. So those are the areas we are talking about. That means there is a lack of competitive employment. There is no big industries in those places. So how we employ them? What is the employment opportunities? So you have to be creative about that. Maybe self-employment could be an option. For example, in American Indian tribal areas, there are no big industries, and some cases they do not have even any internet access. So how we reach them? So you have to have a face-to-face interaction with them. And adjudicated adults and youth with disabilities foster care, individuals with disabilities who receive federal assistance through TNF, and culturally diverse populations, African American, Hispanic American, Native American, Asian American, non-English speaking, and new immigrants. That means their acculturation process with the mainstream of society lags much behind. So, as we know that the new census, then year 2050, our demographic composition will change, because the 50% will be Caucasian and 50% will be other minority groups. So that has implication for education, training, and employment. But the 50% Caucasian, they are not homogeneous group. Among them, there is a lot of cultural diversity. They may be Caucasian, but they immigrated from, say, Russia or Kazakhstan. They are Caucasian, but their cultural assimilation is different. They still doesn't speak good English. In order to, they have skills, but they have to have a communication skill in order to be competitive in the labor market. So we have a diverse population that you can think about it. Then high school dropouts and functionally illiterate consumers. And you will find the high school dropouts mostly in the minority communities. What are we talking about? Target communities. Persons with multiple disabilities, deaf blindness, HIV/AIDS, substance abuse, coexisting disorder, dual diagnosis, all of this. And then of course SSI and SSDI recipient, including sub-minimum wage employees. We know from our previous studies that some of the predictor of the source of referral and source of support at the beginning. So SSI and SSDI recipients has some predicting validity that they will be less employed. So how we can turn that table the other way to improving their skills level so that they can earn more than what they get from the different financial sources assistance. So that way we have to work. Okay, now let's have pictures of the American with disabilities. As of 2014, there are 314 million people with population in the US population, but it's estimated about 58 million or 18.7% of the population are persons with disabilities. But this, it varies from based on the definition used, because in the United States, different federal agency uses different definition. So it could be 25%, you know. But also think about it, in the world, there's 7 billion population. Out of 7 billion, 1 billion are people with disabilities. Think about it. That's close to about 14 point some or close to 15%. But in the developing countries, it is 20 to 25%. So similarly, of course, we are saying 18.7, but it varies according to the definition of different agencies. Okay. So let's talk about the other data. It says 33.9% with disabilities ages 18 to 64 were employed. And look at the figure, 74.2, more than double, 2.5 times than people with disabilities. That's good. But we need to improve their employment situation for people with disabilities. Okay, and then says 28.7% with disabilities of working age were living in poverty. And then this 28.7%, but we mentioned the targeted high leverage group, that poverty level is at 200% of the regular rate. So that means that increases the number of populations in the poverty level. So 13.6% without disabilities are living in the poverty. That means the people with disabilities have more poverty given the situation. So how we can turn around this situation? So there are some information here that if we can educate them, it could be college education, technical education, vocational education, so that will improve their skills of employability, because the world of work is changing very rapidly. Every 6 months we have new job titles because of the technology, information highway, internet, everything. So our life is changing rapidly. My question is, we at VR, are we able to cope with the changing labor market? Are we preparing our people with disabilities with the skills and technology they need? That's what we are lacking. The labor market is going higher rate with more technical information, but are we preparing our consumers with those kind of skills? They could be competitive. So that's the big challenge here. Okay, now you can see that workers with disabilities earn less than their peers. That means they earn 37% less pay for the same job. And you see the education has contributing factor of higher employment or unemployment. In the bottom you see that high school diploma or equal, no college, you can see the earning difference, 29,000 to 22,000. An associate degree 39 to 32,000. With a bachelor's degree 58 to 46,000, and master's degree from 87,000 to 66,000. You can see the gap. So that means if we can educate our transition age in post-secondary educations or higher skill level, they will earn better, obviously. Okay, now here is the employment of persons with disabilities makes society stronger. Here's some information. How does it impact the broader economy? And lack of equal pay cost US economy $141 billion. And then that is about 1% gross domestic product, or about as much as the federal government allocates for education. And then if we employ people with disabilities, so they pay taxes. So if they are not employed, the loss of tax revenue, and that amounts to $25 billion for the federal government and more than $6.5 billion for the states. So that means we are losing. So it's almost $31.5 billion in total tax revenues. So when people with disabilities work, they are not dependent on anybody, they don't take federal assistance, they pay taxes. And we know from our research studies that $1 spent on rehabilitation services and persons with disability return $11 in tax returns in their lifetime, or even more. So that's a good business, training people with disabilities with appropriate skills. Okay, what is the driving issue? What we are talking about? That employment opportunities for people with disabilities is important, not just for those individuals, but for everybody's employers, government and society. The employer needs qualified people, trained and skilled people. So my question is, are we preparing our consumers with the skills that is necessary for the employer or changing world of work? Are we still supply side employment model we are following, or demand side employment model we are following? That is the question. So, you have to learn about what is demand side, what is the demand of the employer, that how we can be a resource to the employers throughout the country. Then we will do a good service to them. So, the VR alone has not been to address the persistent, pervasive and multi-layered needs of the economically disadvantaged communities of national significance. So, that is the barrier, how we can get into that and break the ice in these communities. So, that is the challenge. Now, look at this, civilian with disabilities living in the communities, a percentage of US population by state in 2013. Look at this, where they are located, mostly southern state and some in west and some in up north in Maine, and you can see the distribution. And look at the next one, where are employed. So, mostly middle and in the up north, and look at the differences in southeastern area. Texas is a little better, but look at this, Louisiana, Arkansas, Mississippi and other area, all this area. Okay. Now, let's look into this graph is poverty and disability and economy or employment. There is an intersection of it in all these three combined. What happens with this? Okay, let us talk about this three areas of median household income. So, with the work limitation between 1990 to 2013 is decreasing from 36 to 30, and then without a limitation they are up, and all adults with disability are also up. Then employment rate, and employment rate is decreasing from 28% to 14% with people with work limitation, and others is above. You see the gap, and gap is really increasing from 1992 to 2013, and then poverty rate is increasing, reversely it is increasing. So, 27.5% to 32.1% people with disabilities or work limitation. So, once again I am coming back to what is the purpose of this project? To provide state agencies and their partners with skills and competencies needed to effectively and efficiently address barriers to competitive integrated employment and community integration encountered by persons with disability from economically disadvantaged targeted communities and high leverage groups with national applicability. We already discussed that who are the targeted communities and who are the high leverage groups of national applicability. So, that is the uncharted water. We have been there, but not really there. We did some pay attention, we talk about it, but really do not do very much with them. That is the focus will be this project. Okay. So, in this project just for year 1, we have 4 goals, 16 objectives, 47 action steps, and we have developed the work plan that is 67 pages long. So, you can see huge areas to cover. So, it is a massive work, it is a challenging, we like the challenge, that is good, at least we can break the ice, so that will be helpful. This will be a worthwhile challenge. Okay. Now, number 1 goal, need assessment and outreach activities involving state VR agencies and partners. Okay. We know there are 80 state VR agencies in the US and its territories, because of some agency has one general agency, one combined agency, general blind, and some has 2, that is why 80. How we can outreach to related community based organization, because VR depends on community based organization and community rehab programs for their service. So, also besides that we are going to out to the state rehab councils state independent living councils, and consult with VR agencies about potential TCs that target communities with high leverage groups of national applicability in their states, because they are the expert. Each state has their own regional offices, they know their community better than anybody else. So, that is why we need their knowledge, expertise to look at these communities, and then you are going to evaluate these target communities having high leverage groups of national applicability that VR recommends. We are here to assist VR, so that I know the VR has big case loads and people with significant disability, they are busy, so they need some help. So, that is the purpose of this project, how we can be of assistance to the state agencies, rehab counselors to outreach these people with their assistance, because they know their clientele and their community better. Okay. Then we are going to develop and implement an integrated state of the art information technology platform to support project webinars, teleconferences, video conferences and other virtual methods. So, we are talking about this website, interactive website will help disseminate information and provide to anybody that needs throughout the country, the counselors, community rehab programs, community based organization, target communities, and also exchange ideas. So, it will be interactive platform. And then of course, team showed some of this information about the need assessment. So, here is that 58 agencies has already responded, that is a good return rate, but I think it is coming up more. He mentioned that some other agencies already reported, but not in this graph because it is about 1 week old. So, I think that it is excellent that we are getting a good response rate. Of course, we know that state agency people are very busy, but still they have responded this high. That is excellent, that is a good omen that you are going to have a good collaborations with everybody. Okay. Now, what is the findings of the joint need assessment? So, there are about 9 areas that we are talking about here. For example, by the number of agencies reported that provision of pre-employment transition strategies to students with disabilities, supported employment to youth with disabilities, and strategies to help individuals with disabilities to achieve competitive integrated employment, integration of VR program into the workforce development system, transition of services with adults with disabilities, and then outreach and service provision to persons with disabilities or community leaders from geographic areas with high poverty and unemployment. That is the charge for our TC, how we can outreach those groups, and then of course, program evaluation, etc. So, having this finding, it shows that with other TSCs we have a lot of things to collaborate, because it seems that their needs are also very similar, transition age youth, foster care, juvenile, all kinds of area. So, that means we have a good opportunity to collaborate with each other, and we will do that. Now, okay, I think I talked about that here. Okay. All right. So, what are the major findings that level of TA need for following population with disabilities with limited economic opportunities? So, autism, schizophrenia, other psychotic disorders, traumatic brain injury, post traumatic stress disorder, anxiety disorder with other than PTSD, intellectual disability, other cognitive impairment. So, in fact, this literature review, if you go to the literature, it says the almost similar thing. It is nothing new, but it is nice to hear from the state agencies that they also say. So, that means there is some reliability to this and validity of this need assessment that speaks for itself. Now we need to find the evidence-based practice or evidence-based research how to tackle this issue. That is the focus. Okay, all right. Now it's talking about highest technical assistance need. Okay, this is a little bit in the graph showing the same information. And look at this other kinds of finding. It talks about the high leverage groups of national applicability identified by the responding state agencies. Residents in rural communities, if you see here 42%, educated adults and youth 42% here, youth with disabilities foster care 37%, they are the high figures here. Individual disabilities receiving federal assistance, culturally diverse populations, high school dropouts, persons with multiple disabilities, and SSDI recipient. So, the responses are very interesting to see. Okay. Another findings is that level of concern, about 14 different areas level of concerns the VR has on service provision or factors that limit economic opportunity for people with disability living high poverty areas, and lack of high quality jobs in this area 65%. Okay, high quality jobs, how can you expect that is true. I mean, you cannot expect high quality jobs in reservations or rural areas or islands of Hawaii or Alaska, but the one answer is that how you can improve the skills level, education level, then they will be competitive. But besides that, we have to find different types of job. Self-employment could be an answer. Crafts, suppose for example, American Indian tribe, they have good skills of different local crafts. Okay, lack of self-employment opportunities, that is what we are talking about. So, that could be another area that we can explore more, how to develop business entrepreneurship. Pervasive poverty stress or experience from more than one generation. So, you will see that in the families they receive SSI, SSDI one after a generation, or they are incarcerated from generation after generation. So, how we can break that cycle, that is the point. Lack of affordable, reliable and safe transportation. I think that is one of the major issue, 86%, look at this. Because we do not have mass transportation system, very limited only in the big cities, but what happened to the rest of the country? Public transportation. And also there are other factors, I mean we are talking about the major five. How about child care? That is another major issue. They want to go to work, but who will take care of the babies? Okay. Now, here is a 5 that we just talked about it. Okay. There was goal 1, we talked about need assessment. So, that means that we have some guidance how to proceed. Goal 2, the selection of 10 targeted communities, each with at least 2 high leverage groups of national applicability. Okay. So, objective was to select 5 TCs with the aim of 10 TCs for proposal development during the year. So, in year 1 we are supposed to select 5 TCs targeted communities. That is daunting. And then from the 10 will be selected. So, here is a challenge. The state VR agency we heard yesterday, they said they are already busy and they are going to get involved in developing proposal. We are going to assist them, but the question is they are going to select 10. So, other 5 will say we wasted our time, we have to pay their attention what they are saying, they are concerned. Okay. So, here is our charge that how we can be of assistance to state agencies and identify targeted communities in their state or that area, so that we can develop a quality proposal to provide intensive TA. Intensive TA means we are on the ground with them face to face to learn their needs. I mean, we can find a lot of funding in the research literature, but when you go to the field, it's different. It's not all randomized controlled trial. It has to be qualitative, to hear from the horse's mouth, So that is the main task of this project, to be on the ground with them, with the targeted communities. We are going to learn from them what their needs are, what their challenges, and we try to mediate those issues. That is the charge of this Technical Assistance Center. Okay, so the first year we'll select 10, and then out of the 10, RSA will select 6, and then we'll provide TA. So second year will be another 15 to 10 and 6 like that way. Okay. Goal 3, develop an intensive TA proposal including intensive TA delivery strategies. So we're going to ascertain the VR performance in relation to selected TCs, how they are faring in that community, and that will give us some ideas, and then we'll develop strategies accordingly and provide services. Goal 4, there is a lot of information here, but I will briefly tell you what we will be doing. The first thing is to gather input from TC Advisory Council and key stakeholders regarding content, format and accessibility needs, develop and implement project website, consistent appearance to ensure recognition of stakeholders, and develop implement targeted and general community of practice by both intensive TC sites and other state programs and stakeholders, and curriculum development for training material, best practices and other project related products will be available for targeted and general TA purposes. Now, there is a lot of literature, a lot of research, but the state agency personnel, they do not have the time. So, how we can translate this very simple level at their level, so that they use this information, very short and succinct information, that they will be able to use it. That is the main focus. I mean, research can say all this big terminology, randomized controlled trials, statistical significance, that is immaterial, but how to come down to their level of understanding, very simple, that they can use it. That is the major focus. Now, I am going to show you some of our charges, that areas they will be focusing on, different areas at the same time. That is why earlier I mentioned the charge to this project is massive and multi-level. So, at the same time concurrently it will be addressing those areas. So, I will try to simplify some of these things. So, knowledge development. So, that means technical assistance needs assessment survey, we already talked about this. What we found from those assessment, we are going to use this information, not only state VR agencies, but from the state rehab councils, state independent living councils, community of best practices, all of this. Then we have literature review of emerging, promising and evidence based practices. So, we have to find that, and also we will deal with RSA 911 data that you already saw before, but the state need assessment and other information that available, and also we will find out from the research literature what is the best practices for targeted communities. Suppose something comes to my mind that as I work internationally, the World Health Organization is called CBR, community based rehabilitation. It is a beautiful matrix that how you use, I did not use this here, but I presented some other conferences. It shows all the trees that how to access, use the community to solve the community problem, because community has a lot of resources that we do not know how to use it. because they have their skill, they know what they need. So, you can use those community resources to solve this problem. So, we will use this metrics later on. This is very prevalent in the developing nations in Asia, Africa, and they are very successful. And you can research the literature in the internet, CBR, community based rehabilitation metrics. It is a beautiful metrics, we will talk about that later on. And it says the active involvement of target community expert representatives, focus groups, structured interview, interaction via websites, teleconferences, etc. We mentioned that we will have a web, and there will be facility to interact. People can comments and provide information, we can exchange, provide training, all of this. So, it will be interactive websites. Targeted community selection with input from via state agencies, we talked about that earlier, and of course, intensive TA to the targeted communities. And the technical assistance activities, there are different areas. Suppose targeted technical assistance services means based on needs of common to multiple recipients and not extensively individualized. And main thing is how we can develop a relationship with the technical assistance recipient or more technical assistance center, as we discussed this morning, because we have certain common grounds and common population that will be helpful rather than duplicating, use our expertise to provide quality services. And of course, the targeted technical assistance includes that labor intensive events that extend over a period of time, such as facilitating series of conference calls or on single or multiple topics that are designed around the needs of the recipients. So, the main thing is how we would be responsive to our consumers, our customers. So, you have to develop that relationship, inculcate the relationship, so that they see that we are providing or meeting their needs. Okay, facilitating community of practice. Oh, what happened? I think I haven't plugged to my power. I forgot about that. Let's see. So, it's giving indication. Okay. What is the power? Okay. Okay. Yep. Yep. Thank you. Thank you. Okay. All right. Let's move on to the next one. Technical assistance activities. We talked about general technical assistant. Information provided to independent users through own initiative or multiple interaction with TS center staffs, could be one time or invited or offered conference presentation, TS center staff, etc. All the products that we develop, that will be in our website, so people can use it at the user level, of course. So, one of the example here that we had a web winner in Southern University March 18, then we focus on strategies for engaging individuals with multiple marginalized identities. Please pay attention to this word, multiple marginalized identities. So, having a disability is a barrier. Having a disability with color is a double barrier. Having a disability of color and women is triple barrier. Living in poverty is a fourth barrier, and there are many others. So, that is why it says multiple marginalized identities. And then of course, it says ethical consideration for improving vocational rehabilitation outcomes. And you see our commissioner was the keynote speaker in that, and then her topic was RS's mission on targeted communities in light of WIWA, because that is the buzzword now. Okay. Then our project officer Mr. Felipe Lully, he talked about expectation of technical assistance center on targeted communities. So, he is providing TA to us, and so that is his presentation. And then John Connolly, he is the CSABR, Council of State Administrators of Vocational Rehabilitation. So, he talked about the role of the CSABR in outreaching targeted communities. I mean, you can see because of the CSABR, we have 58 out of 80 response, and it is increasing. That is a good findings. You hardly use a high return rate of any survey, and you heard some state agency personnel says it was too long. It's true, because we combine all the TA centers, otherwise if each one goes their different way, it will be a chaos, and the state agency, well, I can do all this, But of course, we heard one state agency say there are multiple people in their staff, they did part of it. That's a good strategy. That is excellent strategy. It's not burden on one person, based on expertise, they address all the issues. That is excellent finding. Then providing transition planning and education, the effects of, I can read it there, the ethics of being culturally responsive. So, that was from New York University, Dr. Audrey Traynor. We have a NIDER field initiative projects that we are dealing with African American youth with disabilities in high schools, 9th, 10th, 11th and 12th grade, with behavioral, emotional and intellectual disabilities. And I tell you, this was a great learning experience for me and for our staff, because they speak different language. We do not understand them. They have completely different vocabulary, the way they speak, and a certain behavior and manners. I was shocked. But the question is, that's our learning experience. So, the teacher is with us, and they say, well, that kind of word they don't understand, let me rephrase it. Okay? So, we are learning that. So, that is a good learning experience for us. But it's interesting that these kids don't have a father figure at home. Mother works in 2 to 3 jobs, and they want to earn money, they want a big house, car, all this grandiose idea, but they don't know how to get that. So, we have learned a lot, and we talked about career, different training module, certain behavior they have to have in order to be employed, dressing, mock interview, dress up, how to shake hands, all of this we are doing with them, and we are learning in a process. And then we took a field trip to NASA Medical Center in Houston, and they opened their eyes. NASA says everybody can work here, not astronauts. I mean, astronaut to janitor or people skills with culinary art, cosmetology, everything they need. The same thing with the medical center, they have so many jobs available, it opens their eyes. And also then I said, well, let's talk about 3 areas that you want to consider, what you want to be after you finish high school. And they have no idea how to get that job or what kind of skills necessary. So, we introduce them in the computer. Now, search, own it, they never heard of it, and find out what it says the job you are looking for. That will tell what kind of preparation you need. And it's mind boggling for them that nobody told them everything. So, I said, you have a copy, I have a copy, all right. Discuss with your teacher or your guidance counselor, and then we will work together. It's yielding good results. I can see the changes on them, that somebody is really helping, they are very proud of it. So, also we are doing another project with NIDER FIP, same thing, but different level, the college students with disabilities. We are addressing the English and math using cooperative learning process. So, we train the professors of English and mathematics how to introduce cooperative learning, because if your basic education, reading, writing, and mathematics is sound, then you can go forward with different education, different career path. So that's what we are doing. Okay, also that well, Alo and myself talked about predicting successful behavior outcomes for targeted communities. I can read this what I can remember from research and practice or something like that. And then we had health practice, health promotion, effects of impact of persons with disabilities. And this is A.B. Johnson, our faculty, Changi from Illinois, and Jennifer is here. Sanchez, she's from El Paso, Texas. They made an excellent presentation, interactive, and people liked that. That was good. And then impact of peer navigator, program for vocational outcome from Latinos with psychiatric disability, and it was from John Larson from IIT Chicago. It was well attended, it was broadcast, everybody, and we provided CRC, and people liked that. So state agency participated. Okay. So that is just one example. We will be doing similar thing. The other technical assistance activities are labor market information, career development activities, disability with consultation and services to employers about competitive integrated employment. See, employer needs rehab counselor services because rehab counselor has the skills that they can provide services to the employer at no cost. So that is the best thing. That's what the state agencies sell their service to employer as a demand side placement. What is the need of the employer? How we can satisfy the need, and then employer will love you. Because employer need a lot of services. If you have a ready-made client or ready-made worker, they will love that. Okay, building and maintaining relationships in targeted communities with secondary, post-secondary institutions, community rehabilitation programs, and business leaders. So there will be some synergy among all these people, so that we can see the community can help. That's what I am talking about. CBR of the World Health Organization. That's what is needed here. Okay. Also, technical assistant activity. We mentioned about the information technology platform that we will use for website, webinars, teleconference, video conference, and virtual method of dissemination of information on technical assistance. And the National State VR Agency forums dedicated in year 2 and year 4 to discuss progress and lesson we learned from the targeted communities. And the national results meeting of state VR agencies to review the data collected, best practices developed, and lesson learned from the intensive intervention sites served within 12 targeted communities. That will be something very interesting to learn. Okay, what is the outcome? What is the bottom line that we are looking in this TSC or TC? So how we can increase the participation in state VR programs in individual disability from low income communities? Low income communities. So they have a myriad of challenges dealing with low income communities. So they will need multiple level of services. And then how we can increase the number and percentage of same low income communities served through the state VR programs that complete the VR program and enter into competitive integrated employments. That is also transitional. And increase the amount of community support services that will be provided to individuals with disabilities from again low income communities who are participating in VR program from community agencies and support system. I think this is the main focus, amount of community support services. As we mentioned that there are low income families, marginalized people, multiple barriers. So multiple barriers speaks for need multiple services. Okay. And so if we can address this issue, then definitely they will be employable. And of course, it will help state agencies to improve their rehabilitation rate. Even if we can improve few percentage of increase in employment outcome, that's a great savings for the taxpayer money. And then develop collaborative coordinated service strategies among state VR programs, community support service agencies, and systems to provide more comprehensive services to disabilities from low-income communities who are engaged in VR program. So our main focus, how we can be of assistance to VR program. And of course, at the same time, we are assisting the community rehab programs, community business, employers, target everybody. So that's why you can see it is a huge work, network that we have to develop in our program, in our target, technical center. Of course, we will need the collaboration of the state agencies, CRPs, or whoever in the community. And our needs, of course, the other technical assistance center also similar needs. So that's where we can do the collaboration. So that is the presentation, and I would like John Connolly, CSABR, would you please make some comments and to hear from you what kind of suggestion or comments you have. John, go. Oh, would you like to come here, John? Please.
Well, I can.
No, you have to, is it recording?
All right. Well, thank you. As you can see by my dress, I really wasn't thinking I was going to do anything today. Oh, thank you.
You have to go to targeted communities, not with suit and tie,
Right.
Perfectly dressed.
Well, for me, and I worked in the Ohio VR agency for about 30 years, and I think one of the most challenging things that I took away from those 30 years is that there are a lot of different communities, and I remember the first experience about individuals who are deaf and how do you outreach into the deaf community is going back to the 80s. It was a very closed community. And, in the end, I think it was really somewhat of a simple solution. But, if you don't, at the time, we didn't have many interpreters. We didn't have on our staff individuals who were deaf. We didn't have members of those communities, and we didn't have a good way of outreaching into that community. And when we began to show that we valued that community, we started to create a better understanding. Then we were starting to make inroads into the community and establish service provision. In the early 2000s, Columbus, Ohio, I live in Ohio. I don't know how many of you are familiar with Ohio, but really, good. Oh, okay, great. Well, we had a large influx of Somalians, and again, it was a very closed community. I think the purposes of this particular technical assistance center and the reason why it was funded, that's a more current example of a need. And again, it was a question of what kind of strategies can we come up with? How can we reach out into that community? How can we establish a trust within the community? How can we show that we do value them because we start to understand their culture, we start to understand their language. A lot of the things that Madan, you were saying in the project with the University of New York. Mm-hmm. And so I really do appreciate the opportunity that the Rehabilitation Services Administration is providing in terms of support for the agencies to go forward with a project like this. Because and you know this probably better than I do, our country is becoming more and more diverse every day. And if we don't start to develop better strategies to embrace that diversity, reach out to the diversity, understand the different groups, establish trust, establish respect, and so forth, we're not going to be able to achieve the things that are talked about here and change some of those statistics that were shown in the early part of your presentation in terms of the job rate, the poverty rate, and so forth. So one of the things I'm curious about is that, like everything else, there are limited resources. RSA has set parameters. We have so much funding, and we can only reach out to so many targeted communities to do this intensive TA. Madan has talked about the need to have boots on the ground, and I think RSA has been very, very clear. You can understand why, that the technical assistance really needs to go out into the community, bring the community leaders, and more importantly, the resources and strengths that they have together to meet their needs. So just a couple questions. I think, again, there are 10 that we're supposed to select, or RSA ultimately selects them. So if we have more than 10 applicants, if you didn't fall into that group of 10, what would your expectations be from this Technical Assistance Center moving forward?
I would want to know if I could apply the next year.
Sure.
Okay.
Yes.
And would I receive some feedback on how to strengthen it maybe?
Okay.
Yep.
That's great. Anybody else? I figure if Madan can ask me unexpectedly, I can ask you a question, right?
Please come forward if you have a question. I think that because it's being recorded, that would be good. Do you have any questions, comments, or suggestions?
Yeah.
Please.
I guess,
The agency
go ahead.
provided with-
Jennifer, would you come here, please? Yes.
I'll yield the mic to you.
All right. This is Dr. Jennifer Sanchez from University of Texas at El Paso.
Hi.
Okay.
One thing I was thinking is, are the agencies going to get sort of your evaluation criteria so that,
Well, we'll develop our own evaluation criteria. That is true, in collaboration with VR, of course.
and then do the agencies get that so that they can use
Sure.
that to create their
It's
proposals?
Yes, yep. But we'll also assist them to develop the proposal. We don't want to burden them, the state agencies.
Oh, that's
Yes.
awesome.
Yep.
Well, that was
Okay.
my question.
All right. Any other person? Please don't be shy. Come on, we want to learn from you too. Tell me, where are you from?
Eau Claire, DVR.
Oh, which agency?
Eau
DVR,
Claire.
Division of Vocational Rehabilitation.
Here?
Eau Claire. Up
Eau
north.
Claire, Wisconsin. It's another city.
Okay, I see. Here in Wisconsin. Oh, I see. What do you do?
I'm a VR counselor.
Okay. Do you have any comments? That's what we want from here. We are counselor.
No, sorry, actually. Thank you.
Okay.
Mike, I'm a vocational rehabilitation counselor right here in Madison.
Oh, excellent. Do you have any comments or suggestion? Please come over here.
Nothing I can think of right now, to be honest.
Okay. Or maybe later on, right?
Maybe. Yeah.
Please email me, and that will be helpful. Yes, ma'am.
I'm Deepa Pal. I'm with VR supervisor here. I have a
Could you come here, please? Yes.
maybe outreach.
That's okay. No problem. So, tell your name again. Deepa Pal?
Deepa Pal.
Okay.
And-
Turn this way, yes.
All right. So
You were a counselor here in Madison.
I was a counselor. I'm a supervisor.
Now? Okay.
Yes,
Okay.
with Division of Vocational Rehab.
Mhm.
And I have two teams that I supervise, one in Dane County and one in Jefferson and Dodge County.
Okay.
So as I was listening to you, I have been thinking a lot about program and outcomes and whatnot. We do depend our counselors and our program do depend a lot on our vendors, service
Yes,
providers.
correct.
So CRPs. I would want to see if our technical assistance can also be extended to them.
Oh, yes, that's what we
As-
said.
right, and like some kind of certification, some kind of high quality
Training.
outcome training,
Sure.
so that it will have direct impact on the quality, and definitely like now with WIOA, the
Yes.
quantity of service
Sure,
provision.
sure, definitely.
So this was like my sane comment
Sure.
on the whole thing.
Let me respond to you, because we're going to develop training module.
Yes.
That'll be quality,
Yes.
so that we give new information or effective information they'll be able to use in the ground. And then they can receive CRC certification maintenance. So that'll be one benefit for the counselors. And probably we'll develop also certificate of attendance for training. So that's also possible. That's what we'll do. Yeah.
And I was also thinking along the same line, trying to develop service providers from the minority community.
Yes.
So some kind of like certification or something for them. So we, on our list of service provision of providers, if we have like service providers from minority community,
yes, yes.
they do will bring in like more kind of like a bright role model,
Sure,
peer
sure,
model,
yep.
mentor, and
yep.
yeah. So that was like one. The other one, and I wanted to know, it seems like we have participants from other states here. If we have been thinking about expansion of Randolph Shepherd,
Okay.
and where I was going with this was, so that's for more for people with like vision
Sure,
impairment.
That's correct.
So like thinking along the same lines, having something for people with other disability, but maybe having focusing on transportation, as we can
Yes,
see,
yes,
it's a
transportation is a major
high.
barrier, that's
So
correct.
if we have like training program, entrepreneur readiness training for
Yes,
them,
yes.
and some grant or something from Department of Transportation, but more collaboration with other agencies and pushing forward a cohort, a training module for our minority minority target community,
Target community, that's correct.
and going forward with that. So it was just
Oh, you have so much good ideas. So would
I've
you
been
please,
thinking.
would you please write to me?
Oh, yeah.
That'll be helpful. We need this kind of feedback. Okay, any other person, please? How about you?
We're out of time. We're out of time.
Oh, our time? Okay, thank you. Yeah, I think these are good feedback. Okay, thank you very much.